Good afternoon, Mr. and Mrs. Murphy. How are you feeling? I could only imagine what you've been through this morning, witnessing Ian having his first episode of a seizure. However, I'm here to tell you that after performing his physical exam, reviewing his family history and his medical history, we've come to a conclusion that he suffered from what we call a febrile seizure, a seizure caused by a fever. These seizures are not very common. They happen to 3 to 4% of children. They could happen anywhere between 6 months to 5 years old, and kids with a family history of similar episodes are more prone to developing them. Again, I can only imagine how scared you were. But the good news is that simple febrile seizures have no long-term effect on children development whatsoever. I can imagine that you are concerned. What's the chance of Ian to have it happen again? Well, for children whose first episode of febrile seizures happened before 12 months of age, there is a 50% chance of seizure to reoccur. In Ian's case, we have a 30% possibility of a seizure to come back. I do understand that you are concerned if these benign febrile seizures could develop into something more serious. There is definitely a concern like that. However, Ian doesn't seem to have any known risk factors for that to happen in the future. So that's good. I understand that you're willing to be prepared and informed for the next time it can happen. So here are a couple of tips for you. Usually these seizures occur when a child is running a fever. So what you could witness as it starts, Ian could seem a little strange. His skin could darken. He could roll his eyes. His body can stiffen. You could see some twitching movements, and even his breathing patterns can change. So when that happens, and Mr. Murphy, you did the right thing this morning. Try to lay him down on a flat surface, away from any hard or sharp objects. That's step number one. Then I encourage you to turn his head to the side, so in case there is saliva or vomit in his mouth, it would all drain out. I understand you would probably worry that he could bite on his tongue or swallow his tongue. Believe me, that rarely happens, so we strongly advise you against putting anything in his mouth. Okay? We encourage you to call pediatrician after the seizure is gone. However, if Ian is seizing for more than 5 minutes, we would prefer you to call 911 or take him to the emergency department. Here's some reading materials for you to get familiar with. Please let us know if at any point you have any questions. Or another good idea is to call pediatrician and get a consultation on more details. That's a great question. What's the treatment for these type of seizures? Actually, at this time, doctors advise against using any medical preventions of episodes like this. The known medications seem to have more harm via side effects than benefits. So what we recommend you to do is when a child runs a fever, give him some ibuprofen or acetaminophen. They will reduce the fever. They are not there to prevent seizures there, though. Let's make sure we will set up a follow-up with Ian's pediatrician within 2 days, okay? And At this time, please let us know if you have any further questions for me or Dr. Lowry. Okay, then let us know if at any point we could be of any further help. Here's our contact information, and thank you.